Welcome back to CBS This Morning. Right now, it's time to show you some of this morning's headlines. The Verge reports that Amazon's $1 billion acquisition of an online pharmacy proves it's serious about disrupting the healthcare industry. PillPack sells and ships pre-sorted doses of medicine to customers' homes around the country. The news sent shares of drugstore giants CVS and Rite Aid and Walgreens plummeting, costing them about $11 billion in combined market value. Amazon reportedly beat Walmart, which was also in talks to buy PillPack. Walmart has no comment at this time.
Newsweek reports on a study that suggests seeing the same doctor could be a matter of life and death. Researchers in the UK looked at data from 9 countries, including the U.S. 82% showed patients who went back to the same physician had a lower chance of dying compared to patients who visited different doctors. Patients who stick with a physician are generally more satisfied, more likely to listen to their doctor's advice, and have a higher chance of taking preventative measures.
Bloomberg reports that Kroger, the large U.S. supermarket chain, is countering Amazon with plans for self-driving grocery delivery. Kroger will begin pilot tests of its driverless cars this fall at an undisclosed U.S. store. The unmanned cars could help cut down on delivery times and possibly the cost. Customers will need to be home when their delivery arrives to unlock the grocery order. Amazon bought Whole Foods last year and has added a 2-hour delivery program for its Prime members.
And the Washington Post reports that America's cheese stockpile just hit an all-time high. There's almost 1.4 billion pounds stockpile. Now, that's up 16% since 2016, when the government had to buy more than 90 million pounds of cheese to cut the surplus of dairy supplies. Analysts say that higher milk production coupled with lower demand for milk have increased these cheese stockpiles. Milk is more easily stored than cheese.
The Me Too movement ignited a global reckoning on sexual harassment and abuse. Now the New York Times is revealing how the movement changed the brave women and men who shared their stories. The Times spoke to 20 people who previously came forward. Ashley Judd was the first actress to accuse movie producer Harvey Weinstein of sexual harassment and abuse. Weinstein has denied the allegations. Judd told the Times, quote, "I think we can safely say millions of others are here to offer support and hope. Nobody can do it for me, but I don't have to do it alone." CBS News contributor Jodi Kantor is an investigative reporter for the New York Times, and Milena Ryzik is a cultural reporter for the paper. Their reporting helped expose sexual harassment and abuse and fueled the Me Too movement. The Times won a Pulitzer Prize for its extensive reporting. Jodi and Milena, good morning and great to have you with us. I was struck by reading this article and recalling all of these women and men's stories. What made you, Jodi, now decide to go and revisit them and see how they're doing?
Well, going on the record is such a difficult thing to do in this instance. And we wanted to go back to the women, and there's also a man in the package, to see what happened later. And we felt like we wanted to stay with the story. We knew that this was kind of a moment, but we don't think that moment is over. It's continuing to play out publicly, and it's also continuing to play out in the lives of the people who participated in it.
And these were public lives, many of them, Ashley Judd being the first. She told you that she felt liberated, that she felt that she had comfort in some of these other women. Can you talk about this network that they somehow managed to form, comforting each other and thriving off of each other coming forward?
Well, some of them are formal and some of them are informal. There are a lot of instances in which survivors, people who have experienced abuse, have banded together in actual groups. And then some of it is just really informal, and this kind of ineffable feeling that, you know, everybody feels that this happened to them individually, but we now see that this was a pattern, that it was something so much larger. And what was striking to us in our original reporting, and is still striking in the responses, is the commonalities. These women and men don't know each other, totally different backgrounds, different economic type backgrounds, and yet the things they say are so similar.
The stories are the same. Milena, I like at the beginning of the piece you wrote, there was emotional fallout, careers were on the line, yet there were few regrets. At last, their voices mattered. What were the women saying? What are you hearing from the women? What did they say?
You know, a lot of them felt like this was an emotional roller coaster, just having this experience of speaking out. And that was one of the reasons that we wanted to tell this story, because I started hearing from some of my sources very soon after the stories were published last fall. You know, the aftermath is a complicated process, and we want to talk about that. You know, one of our sources felt like the attention that came to her after she told her story, after she told the story, not even just, you know, the process of talking about it. And the people that came to her and wanted her help as a survivor, she said, I needed mental health help to get through that. And another person said, you know, after years of going to therapy weekly, I realized what I needed to heal was talking about this.
I don't need therapy
I don't
anymore.
need
Wow.
therapy. So we really heard a very diverse array of reactions, and that was one of the things that we wanted to highlight. People respond to this in so many different ways, and there were implications for their careers, mostly positive, not all. We had one woman, Drew Dixon, who was in the music industry, who had to leave the music industry, who was basically forced out of it by some of this misbehavior, and now she's back in the recording studio.
Yeah, she accused music mogul Russell Simmons of rape. Simmons, of course, has denied the allegations. She says telling her story was like, and I'm quoting her here, like a weight had been lifted from my shoulders. Explain some of the changes that she went through.
Yeah, I mean, she said that she didn't even know how heavy that weight was until she put it down, which I thought was really evocative. I mean, you don't even know what you're carrying in some cases, how big this burden is. And, you know, these people have sometimes kept this secret for sometimes 20, 30 years. And all of a sudden to see it exposed in this way, to see it on the front page of the New York Times is a really powerful moment in their lives.
I would like to know how you both are hearing, or what you're hearing from men, either men who were perpetrators or men who say that I'm now looking at this conversation and my actions differently, if that is the case.
We're hearing very little from the perpetrators on the whole. With other men, I'd say there's a big difference between the public conversation and the private conversation. And in many ways, it's the private conversation that is the most powerful. We're hearing about lots of men, groups of men who have gotten together and just had, you know, really searching conversations of, have I ever done anything that's upset anybody? How would I even know about it? What is the set of rules that I grew up with, and how does that set of rules need to be revisited now?
Do you think men are still confused, Milena?
That's certainly what we've been hearing, and I think one of the other reasons that we decided to do this package is for people to understand what the stakes are in coming forward, what the effect is, what the effect of this behavior is. I think one of the things I heard in the fall when a lot of this reporting was going on is people not really understanding why women would want to come forward or what happened to them afterward. And again, that's what we wanted to talk about, to see, you know, this behavior impacts people for years sometimes. It might just be, you know, a moment in the office, a moment where you brush up against somebody at the copy machine, but that's something that sticks with somebody and changes their feelings about how their workplace and their professional ambition sometimes. So, you know, you have to think about all of that conduct, and certainly the hope is that talking about this so much in the open this way will change people's ideas about what is and isn't acceptable behavior.
And I think people still wonder, is there a way for men to make amends and move forward, you know, so that they can recover or that they can return? I don't know if that is possible.
It's a question that a lot of people are asking,
Yeah.
and it's, you know, heartening to know that there's some people that are telling their stories, but there are so many who are afraid to tell their stories and afraid of the repercussions.
That's what we wanted to do. We wanted to give people out there a sense of, if you actually go forward, if you do the brave thing, here's the way you may feel afterwards.
Incredible reporting as always, Jodi Kantor and Milena Ryzik. Thank you both for being here. We appreciate it.